When we're assessing TMACS, one of the most important questions is whether the patient has ECG changes compatible with acute ischemia, or in fact, I think the phrasing is acute ischemic ECG changes. So what are acute ischemic ECG changes? It's a little bit subjective, and that was deliberate when we derived TMACS, because there's always a little bit of subjectivity when you're interpreting an ECG. Now, changes compatible with acute ischemia include ST depression, T-wave inversion, and of course ST elevation, though if you've got an ST elevation myocardial infarction, those patients shouldn't have TMACS scored. They should go straight for the cath lab. We don't have any diagnostic uncertainty for those patients. This is really going to be used for patients who don't have diagnostic ST elevation. If the patient's got previous ECGs, you can compare the ECG to their previous ones. And if the changes are known to be fixed and they just haven't changed, well, I guess that's not really compatible with acute ischemia because the ECG changes are fixed. So you're able to say that the patient, those changes are not acute ischemia in that context. If the patient has left bundle branch block and you're not certain whether it's new or old, that would be compatible with acute ischemia. If they've got old left bundle branch block, well, the ECG is unchanged. It's not really compatible with acute ischemia. You might look for other changes on the ECG that might be a marker of acute ischemia. So that's really what we're looking for when we're trying to assess acute ischemia on the ECG and TMACS. Remember, sometimes those changes can be very subtle.